Hello and welcome. This is Hands on Health, the podcast all about living your healthiest life on the coast. I'm Austin Miller.
And I'm Alyssa Evans. Today we're joined by Kendra Gohl, CMH's infection preventionist. Kendra, thanks for joining us today.
My honor. Thank you for inviting me.
To get us started, would you mind telling us what is the infection prevention department at CMH?
Just to let everyone know that every hospital actually has to have an infection prevention department, so we're not unique in that. But the purpose of an infection prevention department is to support and improve the quality of care that's provided to patients. And that's done through implementing infection prevention related regulations, recommendations, and best practices that are set by professional organizations. I work to prevent and identify situations that could lead to infections that could develop in patients and staff during their healthcare experience. So whether they're working or whether they're as a patient. It's kind of hard to say what an IP department does in a few sentences, but in a real life situation, I'm the person that's behind the requirements that ask staff to hand wash and hand sanitize before they see a patient. I'm the one that's behind the expectation that they wear certain kinds of gowns and gloves and masks to prevent them from being exposed to an organism that they could then spread on to another patient. I'm behind the practices that relate to the instruments and how we sterilize them and how we clean the room before you as a patient comes into that room. So I work to ensure all of our methods are up to date. I work with leaders and staff to monitor those practices, and I monitor to see that if they failed. So if a patient were to get an infection.
Wow, that's a lot. What got you into this?
I actually am a registered nurse, and I went into nursing working in the cancer field. So that's kind of how I came into the nursing career. And I worked doing bone marrow transplants. Bone marrow transplants, the whole essence of everything around the care of a patient who's getting a transplant is infection prevention. So that's what I did for a number of years. And then when we moved here to the coast, I worked in a labor and delivery unit, actually, for another organization. And then the role of infection prevention came up, and it was actually a joint role of infection prevention and clinical education. And I was really enticed by it. It's like, wow, infection prevention, I did that. That's what I did all the time in my other role. And it was just a good position change for me based on what we wanted to do as a family. So I got the job, and I've been the infection preventionist ever since.
And how long has that been?
Oh, a long time here at CMH. So I've been here for 31 years. Crazy. The time has just flown by. I've had the amazing honor of actually being a manager or director over many different service lines and areas. But the entire time, despite or including those roles, I was always the infection preventionist. And then what I call like a pearl of the pandemic. There are some pearls that came out of the pandemic, but one of those for me was that the organization decided as a result of the pandemic to make infection prevention full-time. And so I just moved right along with my passion area. I really enjoy implementing practices to keep patients and staff safe.
I think that's really fascinating to hear about. And I didn't know that you had worked in cancer care with bone marrow before that. So It's really neat to get to hear that backstory too.
Yeah. They all connect. All the roles kind of connect. So like I said, I've done transplants, I've done med surg, I've done critical care. Those were all somewhat connected to that role, but also independently. And then I've done labor and delivery. And here at this organization, I've done a number of other things. I've overseen quality, even marketing for a little while. As a nurse, that was kind of interesting. Diabetes ed, community ed, staff ed. And I was a director of nursing most recently before I moved into the full-time IP.
Yeah, I think that's really impressive. It's definitely, I would say, a little bit of everything and then some.
Yeah. Well, that's usually how a lot of nurses work.
Yeah.
So they tend to, that's one of the benefits about working in certain fields in healthcare, but nursing is definitely one of those that you can move into different areas based on different phases in your life or different interests that you have.
Would you mind sharing what brought you to the Oregon coast originally?
It was actually family. So my husband and I, when I was doing transplants, we lived in Seattle, and we just had a family need we needed to move back to the coast for family reasons. And so we did that. And we actually came back to his hometown. My hometown's a little farther down the coast, and kind of we're here for family, and more family needs arise. And then we started to have our own children, and pretty soon, truly, time just flies by and you're here.
That's awesome.
Yeah, we love the community. His family's very much tied to this community, and we are too. I mean, it's a beautiful place to live.
So you've touched on this a bit already. Do you mind getting into a little bit more detail about what your job entails? And I know there might not be a typical day, but what does your week look like usually?
So as you said, my day can vary. It can be totally different. It can be fully full of meetings one day and then not. But generally speaking, I have certain things I do every day. So every day when I'm working, I review all of the patients' charts that are in the hospital. My goal is to look to see if they have different things that I can help support nursing and intervening with to help prevent infections. So that may include, hey, this patient needs to be put in what we call transmission-based precautions, or that may be what other people call isolation, which means you have to wear a gown or a mask when you go in that patient's room. Or it may be this patient's had a catheter for a certain time. Can we get that catheter out? Because if we remove those things, it decreases their risk of infection. So I'm looking at those charts every single day. That's one of the things that I may do. I visit departments regularly. So I do environmental rounds looking for different ways to help prevent infections in the department, but also to help support staff if they have questions. I meet with departments for educational needs, so constantly educating with them, reminding them, helping with orientation. Do a lot of chart auditing. So a huge part of infection prevention is looking at charts and ensuring that patients didn't develop infections. So going back and really looking at the care that was provided and how it was charted. And if I do find a case where a patient did develop an infection, then I do what's called a deep dive or a root cause analysis. And I really look at all the aspects of care that they had so I can identify, could we have prevented that? And if so, how can we prevent that for the next patient? What went wrong in that situation? I also work and lead a number of multidisciplinary teams that help to look at our programs and ongoing to ensure that we're providing optimal safety measures. So teams of people who represent many different departments in the hospital, and we get together with this purpose, and we continually look to say, are we doing a good job? So that's really important. But I'm going to say one of the largest aspects of my job, and this really grew, especially during the pandemic, was probably one of the most overwhelming elements during the pandemic for this position, was keeping up to date. So a huge part of this role is to keep up to date with the best practices or new innovations related to infection prevention across the organization. So I'm looking at best practices that may affect housekeeping, to surgical kinds of processes and sterilization, to new patient care products. These are always ever changing. If you imagine trying to keep up to date with what's the newest TV channel you can watch, right? Well, put that on steroids and multiply it by 100,000. That's what happens in the world of infection prevention, of new things that come out. And especially with our new emerging illnesses. So we're not ever going to be done with COVID, and as things that were happening in our world around that were things, we still had Ebola occurring. And even though people may perceive Astoria as low risk for Ebola, we are at risk of a potential Ebola patient because of our waterways and our number of foreign going ships that come through, and we're often the first port that they can reach. We had MERS, we continue to have SARS, new flu viruses, all those things you have to kind of stay up to date on. So that's a huge piece. I review new products, like I mentioned, and services related to infection prevention. I'm a part of all the new construction projects that we do because I have to ensure that we're creating a safe environment, but I also have to ensure while we're doing renovation that the current environment, if there's patients and staff around it, are kept safe during construction. I work on water safety and airborne safety. So all of those things in a month and a week and a day can happen. And I answer a lot of questions from staff.
Yeah. Well, I definitely know I run across you a lot in the hallways and just out and about throughout the hospital campus.
Yeah.
You mentioned earlier some of those pearls of the pandemic. Mm-hmm. Obviously, the pandemic brought kind of you've probably been focused on this your entire career, but for everyone else who's not an infection preventionist, I think everyone got kind of a new awareness of some of those efforts that go into doing that and preventing infections with the pandemic. Mm-hmm. What were some of those other pearls of the pandemic in your eyes?
Well, what I would say one of the biggest pearls of the pandemic, and I talk about this a lot with new employee orientation, is that the entire world became aware of these terms that we kind of only kept within healthcare environments: droplet, airborne, contact. Right. So those are the ways that organisms tend to be spread. And I think that people really didn't understand or attribute that potential risk of how something is spread on a droplet or in the air, or even sometimes in contact. But specifically, if we think about droplet and air, those are the biggest elements. And there's definitely some things to learn from that. And I think it's important, even though hard to hear, for many individuals, COVID is not ever going to go away. We're going to have to learn to live with COVID and its variants and or whatever new organism comes up. And that we do have an active role, and I think even a personal role in helping protect others around us when we're sick. And being aware that a lot of people didn't realize that even as we sit in this room, we create droplets that fly from our face and nose for about 6 feet that you can't see. And so you've been breathing people's droplets in your whole life. And you have your immune system and your actually your gastrointestinal system that help protect you from those. But when there's actually a bacteria or virus that's small enough to grab on that droplet, that's how you get infected. That's how you get colds and flus. And people do fairly fine with those and have always historically. But we are seeing some people who don't do as well. And so how do we think about that in airborne? And again, how do we protect other people when we're sick? It's just a kind of a whole new world. You don't want me to sing that song. So that's the main pearls, I would say.
You've talked about this a little bit already, but do you have suggestions for how listeners can protect themselves from infections and stay healthy?
Sure. I wouldn't be a good infection preventionist if I didn't start out with hand hygiene. And hand hygiene includes hand washing and hand sanitizing. I mean, that's just the baseline element of how you prevent the spread of most infections. So really reminding people to use appropriate hand washing techniques and hand hygiene or hand sanitizing before they eat, especially after you cough or sneeze, after you use the restroom. And I highly encourage people, you may think you're a good hand washer, but take a look on the CDC websites at the videos they have and the directions. It's really important. The directions that we talk about, doing the friction with your hands for 10 to 15 seconds, and that's hand sanitizer or hand washing, is really backed by decades of research. All right. And I think a lot of people don't realize that rinsing your hands is just as important after you've scrubbed them and all of that, because that's what gets the organisms off your hands. So being very vigilant about that's number one. Then number two, kind of playing off what I was mentioning before as a pearl, the pandemic is actually masking if you're not feeling well. So one of the things that I think is going to take us into the next place, and I know that we've implemented some elements within our facility around this, is I really want to take COVID and kind of pull it back. This is how I visually talk about this, off the front spotlight and put it on the same shelf as flu and colds and norovirus. But really, we need to think about true influenza, RSV, and COVID very similarly. Pull it back and think, how do we prevent people from getting that and how to spread that? Well, the number one thing is, if you don't feel good, put a mask on. I have the sniffles today. It could be my allergies. Well, if you think it's your allergies, take your allergy medication. And if it didn't go away, it's not your allergies. But put that mask on and keep that mask on when you're around other people for about 10 days. And I say 10 days because most people don't realize that if they have true flu or RSV, which can often appear as a cold in adult individuals, or if they have COVID, it's true flu and RSV will be spread for about 7 to 8 days, even after your symptoms get better. And COVID, we know, can be spread for 10 days. And those are all from the start of your symptoms to the place. So put that mask on when you go out to the store, go out for the next 10 days and just keep other people safe, because you don't know who those people are around you that are immunocompromised. And then I think the other thing that people need to realize, and I'm not sure that they know that, is that when you wear a mask out and you're trying to protect yourself, a cloth mask is not going to protect you anymore. All right. A cloth mask will not protect you if everyone around you is unmasked. You have to. So if you're wanting to protect yourself, like you have a big special event and you don't want to get exposed or whatever the case may be, you have to be wearing at least a medical grade mask that fits well to your face, or a KN95 or N95. I see people out in the community at the store or whatever, and they're wearing their cloth mask. And I think, boy, are they trying to protect themselves? I worry for them that they don't know that they're not. And that's a risk that they just don't understand. And those would be the three things. Of course, hand washing and then masking when you're sick to help protect. And the rest of the world masks. If you travel to other countries, this is what they've done to help prevent the spread of illness, is that when they don't feel well, they put a mask on. And then knowing what kind of mask to wear to protect yourself. Of course, I could talk for hours about other things, but those are the main community things.
Have there been any standout experiences that you've experienced in your role that you'd like to share?
Definitely. One of the things that I take a lot of pride in, and a lot of people don't remember this, is that several years ago, I'm not even sure if I could tell you how many more or how long ago, the Centers for Disease Control came to Oregon, which is kind of a big deal for CDC to come visit. And our hospital was chosen for them to come see because of our outstanding infection prevention programs and our low healthcare acquired infection rate. And it was a big deal. And I'm not sure, if everyone really knew that or understood that. But for me, that was a huge thing that stood out in my career. And then the second thing is going to be the pandemic. And there's no doubt in the world of infection prevention, and people in our facility have heard me say this, we had been preparing for a pandemic for a good 20 years. We'd talk about it at conferences. We'd talk about things that could be implemented. But the challenge is you can't fully ever prepare because you don't know what the organism will be. You don't know how it'll be transmitted, and you don't know the symptomology that it will present with. And that's the most challenging thing that we saw, obviously, in the pandemic. So you can't ultimately prepare. But I will say that we did very well as an organization based on the preparation we had put into place. And I saw that in our teams. So for years, we would annually pull together certain key individuals and talk about what if this happened. And I saw them, whether they realized or not, use that muscle memory to go into action when we started to see that pandemic about 4 years ago.
Goodness,
right?
It's been that long, hasn't it?
February, I believe it was either the 20th or 23rd is the day that I got the call that we thought we had our first COVID patient. I'll never forget that call. And so just moving through that pandemic and having that experience and being able to use truly all of my decades worth of experience to help, that was probably one of the biggest things. And one of the things I'd like to forget.
Wouldn't we all?
Exactly.
Sorry, I'm holding back a sneeze. It's a really bad time to do it. If I do it, you're going to hear it really loudly.
I sneezed earlier. It's all good, right? You're going to edit all that up.
Well, I think that's really amazing. I already really, what's the best way to say this? I already really respected your job, not knowing how much went into it, but I think it's really, really inspiring to know how much you do with the patients and with the caregivers, and it's a lot for one person, and I think you do a great job.
Oh, well, I really appreciate that. It's actually pretty cool to be an infection preventionist in a small rural or a small or to moderate size hospital, because usually there's only one. And so you're really working with every single department. As compared to sometimes when you get into large urban roles, the infection preventionists will be committed to a specific floor, and that's what they'll do. So they'll be the infection preventionist for the pediatric intensive care and the neonatal intensive care, or just for surgery or whatever it may be. And of course, they hone in their skill set and they do all that. And what's really fun for me as a rural infection preventionist is I got to be able to hone in my skills on all of them. Right? And help support, because oftentimes we bring in new leaders who may not have a lot of true experience in that specific role. And how do we help grow them and educate them and move that on? So I've really enjoyed being an infection preventionist. It's fun and challenging, always keeps you on your toes, and also gives you some downtime once in a while to kind of catch up. So it's nice that way.
Well, great. Well, Kendra, thank you so much for coming on the podcast today and telling us a little bit about what it is that you do.
No problem.
Yeah. Is there anything else that you would like to share with listeners that we haven't talked about?
Yeah, I think it's really important for the community, especially our community, to know how committed CMH is to their safety. That the IP program has always been, and I'm very thankful for that, very supported by CMH. Hospitals across the country have been battling with healthcare-acquired infections as a result of the pandemic, being distracted and overworked and stretched, a number of other things. And we've been very lucky. Our infection control rates are extremely low, and we're all very proud of that. And it's just because of the hard work of all of our individuals. And healthcare-acquired infections are tough because not only are there multiple factors that can lead to them, there's also patient factors that can lead to an infection that we have no control over, and patient choice can play a part in some of that. So just understanding that CMH is just truly committed to their safety, and that I'm here, and that if you have questions in the community, ask them. One of the things I love to do, and I don't get to do it very often in my role anymore, is see patients. So if a patient has a unique infection control question or the staff aren't able to truly answer it, I love meeting with people. And I've had community members call and say, hey, my family member has MRSA and I really don't know what to do in my home. Well, let's talk about it. Or they'll want to come in and meet with me and talk through some solutions. Use me. That's what I'm here for. The organization has spent a lot of time committing to my education and training, and I take that very seriously. So I want to help. So just give a call and I'll answer any question to the best of my ability.
That's great to hear.
Well, I think that's all we had for you today, Kendra. Again, we really appreciate you taking the time out of your day to tell us in the community a little bit about what it is you do and some tips on how we can all avoid those awful sicknesses that just always are after us.
And thank you for joining us today. This has been an episode of Hands on Health, brought to you by Columbia Memorial Hospital in Astoria, Oregon. CMH is an independent, not-for-profit health system that provides comprehensive, person-centered care in Northwest Oregon.
Find us wherever you listen to podcasts, online at columbiamemorial.org, and on Facebook, Instagram, Twitter, and LinkedIn. Thanks again for listening. We hope you'll join us next time for another episode of Hands on Health.